Welcome back to CBS Mornings. President Biden is calling to expand COVID testing with the emerging Omicron variant spreading globally. The CDC says more than 660 million COVID tests have been performed in the U.S. during the pandemic. Now, costs are supposed to be covered under most circumstances. But as part of our medical Price Roulette series, in collaboration with Clear Health Costs, our consumer investigative correspondent, Anna Werner, has been hearing from some people who have been getting very large and confusing bills. Anna, what's going on here?
Well, Nate, good morning. You know, COVID tests are supposed to be covered if you have insurance. But we've been hearing from people who've gotten bills for hundreds or even thousands of dollars. Like one Texas resident who says he's caught between a medical provider and his insurance company.
Jaden Yannick lost his 75-year-old grandmother to COVID-19 in November 2020.
She tested positive on a Wednesday, and by the next week, she was gone.
So last December, when he learned he may have been exposed, he went to get a test right away.
I wanted to be really proactive and get a rapid test to ensure that I didn't have the virus and I wasn't going to be spreading that to my family.
He went to the Tulsa ER and hospital for a test he says he thought was free. But several months later,
I received a bill for $2,700 or so.
How did you feel?
Yeah, I felt very angry. I felt deceived.
That bill for the emergency room and lab fees. Then the doctor's bill landed, some $1,300. The total, over $4,000. But his insurer, Blue Cross Blue Shield of Texas, said not to worry.
My insurance informed me that they would be sending a check in the mail, and then I would just need to send that check to the healthcare provider.
He did receive a check, which he sent to the hospital. But unbeknownst to him, he says, a second check Blue Cross sent him never arrived, leaving him fighting the hospital's bill and getting collection calls for nearly a year. When we inquired, Tulsa ER and hospital told us they'll accept whatever money his insurance company sends him, and once they get it, Yannick won't owe anything more.
What if this happens to someone else and they do truly believe that they are personally liable for these charges? How are they going to be able to make ends meet given where the economy is?
And he's not the only one confused.
I can tell you the consensus of our friends that have heard about this is, what do you mean you got charged for a COVID test?
Barry and Jamie Costanzo of Myrtle Beach, South Carolina, plan to visit their grandchildren in September, but say they developed symptoms.
We wanted to be sure that we weren't contagious and had COVID.
They went to the only location they say had rapid tests available that day, the Conway Medical Center. Their results? Negative, but they did get the bills, totaling some $570 after their insurance paid.
They tell you you're negative, then they ask you why you're here, and then they look in your ears, nose, and mouth, and the next thing you know, you get a bill, non-COVID related.
Conway Medical Center told us the Costanzos went to the wrong place, to the hospital's emergency department triage tent, that if they wanted a free COVID test, they should have gone to the free drive-through testing. Since they were technically at the emergency room, Conway says it was legally bound to medically evaluate, treat, and discharge them, in this case, for allergies, treatment the Costanzos say they didn't ask for.
Why would I go to a hospital or to any testing site for COVID if I was there for allergies?
Can you explain why is this so confusing?
Part of it is because our healthcare system is very complicated and confusing.
Professor Sabrina Corlett of Georgetown University says examples like those are cropping up, even though a law passed last year requires insurance companies to cover tests and any associated treatments.
If you get a physical exam, or they say, well, let's test you for flu or other things as well, all of that visit is supposed to be covered by the insurer.
Now, does that mean covered completely, 100%?
Well, it's supposed to be, and we have heard of some providers tacking on certain fees. Sometimes they're called facility fees or emergency room fees.
And it turns out that's exactly what we found happened to the Costanzos. They were each charged $771 for an emergency room fee, which their insurer would not pay in full, leaving them jointly with bills of about $570. Their lesson for others?
If at all possible, don't go to the hospital
Just
for a
go to
COVID
the
test.
pharmacy.
Go to the pharmacy.
Well, the Costanzos are appealing their bill. They gave permission for the medical center to discuss their care with us. Their insurance company, Blue Choice Health Plan of South Carolina, did not respond to our repeated requests for comment. As for Jaden Yannick, his insurance company says they're going to issue that second check he needs to get him out of this. But in the meantime, Tulsa ER and Hospitals tells us they've since changed their procedures. So instead of the check going to the patient, who then has to send it to the hospital, now the checks will go directly from Blue Cross Blue Shield over to the hospital. They also say they're following all laws and regulations here as well. Now, if you have a medical cost story to share with us that you want us to hear about, email us at healthcosts@cbsnews.com. Vlad?
Anna Werner with that critical reporting as always. Anna, thank you very much.